afternoon. Consider for a moment our community's growing drug and alcohol problem. What do you think our most powerful tool is in solving this problem of addiction? Some people might think treatment. You might say law enforcement. Others would say alternatives to incarceration. We've got education, advocacy. These are all important, but the most important thing in solving the disease of addiction is belongingness. Belongingness is simply being a part of something that's bigger than ourselves. And we know that belongingness has been proven not only to prevent addiction, but it's also been proven time and time again to be the key that helps those that are suffering from the disease of addiction get better and stay better. I'd like to introduce you to my friend Jack. Jack is many things. He's a father, he's a grandfather, he's a mentor, he's a runner. He's also a person that's in recovery from the disease of drug and alcohol addiction. 3 years ago, Jack lost everything that was important to him because of his disease. He lost his family, he lost his job, and he nearly lost his freedom. So when I've talked to Jack about what it took from getting from that rock bottom stage of addiction to where he is today, he talks about the people in the community who reached out to him to try to find that connection for him. He was invited to join a group called RAD, which is Runners Against Destructive Decisions. So Jack found his sense of belongingness in the running community. And that's what I'd like to talk about today, is how that simple thing, belongingness, can make such an incredible difference in the lives of people that are struggling with behavioral health conditions like addiction. North Dakota's behavioral health system is in a uniquely dire situation. We know that behavioral health is a concern across the nation because 1 in 5 adults suffers from mental illness in a given year. But in North Dakota, a recent report on our behavioral health delivery system literally starts with the sentence that North Dakota's mental health and substance abuse treatment delivery center is in crisis. And it goes on to explain that we simply don't have enough resources in place in our state to deal with this growing problem. We know that more youth than ever in our state are struggling with depression and have attempted suicide. We know that our rates of drug addiction are skyrocketing, as are deaths from overdoses. In Bismarck Marathon alone this summer, we've had 4 deaths. And we know that Fargo and Grand Forks have had twice that many. And we know too from a school survey that 18% of the kids in junior high and high school tell us that they have taken a prescription medication without a physician's prescription. And on top of all that, we've got our state's budget shortfall. So we've got this already very overburdened behavioral health delivery system, which offers such limited access to the newly diagnosed and even slimmer access to people who don't have health insurance, and now we're facing funding cuts. So it truly is a crisis situation. But there is good news. As a state, we have a lot going for us, not the least of which is our North Dakota NICE, and we have great capacity to make change. In our junior high sociology classes, we learned from Maslow's hierarchy of needs that if we don't have enough belongingness in our lives, we're more susceptible to depression, suicide, heart disease, and addiction. And we learned too that if we have an abundance of belongingness in our lives, we are far more likely to sustain the bad things in our lives. So consider, for an example, a 3rd grade boy who has a parent who's suffering from the disease of drug and alcohol addiction. That little boy is less likely to be negatively impacted by the environment that he's living in if he's got that sense of belongingness in his life. And that can come through the school basketball team, Boy Scouts, a neighborhood club, anything that helps him feel a sense of belongingness. So outside of my family, this is where I feel my strongest sense of belongingness. I am blessed to be part of this wonderful group of friends who happens to share my love for running and triathlon training. This is a group of people who celebrate each other's successes as if they were our own. And when somebody's going through something that's just horribly hard to bear, these are the friends that are always there. My friend Leslie, who's on the right side of this photo, my left, is a person who helped me really understand the value of this belongingness. Leslie grew up with a father who sexually abused her. That's a trauma that manifested itself in behavioral health conditions that followed her well into adulthood. And Leslie says that it was becoming connected with this group this group of peers that showed her that support and unconditional love, is when something finally clicked in her brain and she was able to let the past go and focus fully on the future and devote all of her energy into helping others. And Leslie's inspiration was to bottle this magic that a group like this has and then give it to kids who need it most. And so what transpired was Team Kaizen. Team Kaizen is a community-based, character-building running group for adolescents and young adults at risk. It's a training program designed to help our team members run a 5K race. It's led by volunteer running enthusiasts who are trying to give the runners a positive mentor to help them adopt healthy lifestyle choices into their daily routines, and also give them a chance to be a part of something that's bigger than themselves, that belongingness. Kaizen is a Japanese term. It means process improvement, and translated loosely, it means many small changes over time equal great change. When one of the team members is ready to run their race, a team mentor runs with them. So we run side by side, encouraging them, telling them jokes, whatever it takes to get to the finish line. And sometimes it's a struggle, and sometimes runners like Savannah sail through the finish line. But regardless, these kids always make it to the finish line. And they're always going to have the knowledge that they successfully set that goal, they did the really hard work, and then they literally crossed the finish line. We have some built-in incentives with the program to keep the kids engaged. If they come 3 times, they get a Team Kaizen t-shirt. And if they come 6 times and they don't have their own running shoes, we'll take them shopping and buy them a pair of running shoes. Team Kaizen started in February 2014, and so far we've had about 120 people come through the program. We've purchased 50 pairs of running shoes. We've paid for 75 5K registrations, 3 10K registrations, and even 1 half marathon registration. The team's vision is to be in as many North Dakota communities as possible. And this last winter, we actually got an affiliate going in Fargo, which is where Leslie happens to live. One of the bonus effects of working with Team Kaizen is just the wonderful feeling that the mentors have when we're done with the team workout. We go home flying high, know that the kids are working hard and that they're supporting each other. So the physiological explanation for what's going here is oxytocin. It's the chemical oxytocin that gives us that feeling of love, of friendship. It's that wonderfully safe feeling you get when you know somebody's got your back. You get a shot of oxytocin every time you do an act of kindness. You also get a shot of oxytocin when you're the recipient of an act of kindness. And I'm glad you can see Kathy, because right here she's showing her high levels of oxytocin. So let me switch gears and tell you about another volunteer-based organization in our community. Face It Together is a community addiction management organization designed to break down barriers to care and change the way we think about and solve addiction. At the core of the Face It Together model is volunteer peer recovery coaches. So it's people in recovery who have stepped up to volunteer to help others that are suffering from the disease of drug and alcohol addiction get well and stay well. The Face It Together model is a evidence-based, effective, cost-effective way to quickly add to our behavioral health workforce. Because not everybody that suffers from the disease of addiction needs to go to treatment, and not everybody that suffers from the disease needs to see a mental health professional. Thousands of people who've worked with recovery coaches at Face It Together have managed to get well and stay well. One of the ways that Face It Together is working to solve addiction is changing the language that we use. Because the saying that words will never hurt me is patently untrue. We know that words can hurt us. So hurtful words that Face It Together is teaching us to not use are words like addict, alcoholic, drunk, dirty, sober, and instead use words like addiction, chronic disease. And the rhyme to the reason here is that these words are medical terminology versus condemning terminology. Because addiction is a disease, it's a chronic disease, just like heart disease and diabetes. And so when we start treating it like a disease and talking about it like a disease, we'll start having better outcomes. Dave Jansa is a recovery coach that works with a Face It Together affiliate in South Dakota. One of the first things he explained to me is that for a person in recovery, one of the most important things for them to do to stay healthy is to help other people get in recovery too. And so these recovery coaches that Face It Together are getting that same dose of oxytocin that the Team Kaizen mentors are getting. And one more thing about oxytocin, we know that it reduces our level of stress and anxiety, and we know that people that have an abundance of oxytocin in their systems are far more resistant to addiction than people who don't have a lot of oxytocin. So my friend Jack ran his second half marathon last fall in Bismarck, and when I saw him cross the finish line, I made a beeline over to congratulate him. He was surrounded by his family, family that he thought he had lost, but were actually supporting him the whole time, and they were certainly supporting him that day. In my mind's eye, I saw a man who had lost everything, but searched for a way to get his life back, and he found that by belonging in the running community. So when I finally got my chance to talk to Jack, I congratulated him. I gave him a hug and asked him how he felt. He said he felt great. He was obviously so happy to be surrounded by friends and family that support him and love him unconditionally. But then he got serious, and Jack looked at his watch, and then he looked back at me and he said, almost like he was confessing something. He said, you know, I felt great, but I missed my goal time by a minute. So I was happy, sad. I just simultaneously laughed, cried, and said, oh my gosh, Jack, you're a runner. Okay. Oh, thank you.